Good morning.
Good morning. Meron, reserve ko rin yung merinda ko dito. Yung merinda ko dito po.
So, thank you very much for attending this. This is really very timely. It's not our first time to meet. Diba? To see each other. Nagkikita na po tayo sa DRRM trainings, DRRM workshops, and now we have this very more specialized training, which is training nutrition in emergencies. This is because during disasters, ano po yung mga vulnerable natin doon? Kung disaster, ano tayo na disaster, sino po yung mga vulnerable natin?
Senior, kawadi,
sick
people,
lactating, are malnutrition, di ba? Yung mga malnourished, yun po yung mga tinutukan natin. But since we are speaking of disaster risk reduction and management, we have to be proactive. Okay, so hindi natin hahayaan na during disaster lang tayo mag-respond, but with your cluster, sa nutrition cluster, meron po kayong pwedeng gawin before magkaroon ng disaster. Para sa ganon, hindi magiging vulnerable yung ating mga malnourished children, pati rin yung mga senior citizens because they are also considered vulnerable. Okay? So, climate change, conflict, and global economic volatility are still contributing to the increased frequency of humanitarian emergencies worldwide. So, global concern po itong pinag-usapan natin because of ito yung climate change kasi pag ina-affect mo yung isang system, ito yung affect. May domino effect yan from one sector to another sector. Okay? And emergencies put affected population at a much higher risk of becoming malnourished. So yun po, ngayong during the pandemic, di ba yung mga malnourished natin, ay ang critical doon is yung access to food. Di ba, nung nagkaroon tayo ng lockdown, and lucky we have sufficient food supply, but paano kung wala? So, Baguio LGU is just one of the lucky local government units, pero paano po yung mga nasa 5th to 6th class municipalities? They are very dependent po sa DSWD at saka sa mga donations. So, ito po actually yung mga ina-address natin because if we are not proactive enough to address malnourishment, it will lead to higher risks. Ibig sabihin, magkakaroon po tayo ng mga cases or deaths. Diba? At yun ang iniiwasan natin because of the global target really is to minimize or ideally to have zero casualty or zero death during disaster next week. And since binigay naman itong training objective sa akin, we'll just read that. Okay. So the purpose of the training workshop is to build the capacity of health and nutrition workers and order and other partners to manage, prepare, and respond to emergencies. Pati may other partners because it's not only the LGU. Diba? Aside from the city LGU, nagkakascade yan sa mga barangays. And the barangays are at the forefront, diba, during disaster. And bakit siya, and other partners, there are other partners at the barangay level and even at the city level which engage the participation of our civil society organizations and other private sector. Because DRRM, climate change is a whole of society approach. It's a whole of society approach. It is everybody's business. Lahat po tayo may role during disaster. No? And the workshop builds individual knowledge and skills while building a sense of teamwork and collaboration. Since nung nagtagal naman itong pandemic natin, we have already built our teamwork. Hindi pwede during disaster, may competition pa rin. We should be one working together, di ba? During disaster next week. And the specific objectives explain the importance of nutrition in emergencies. Nako, kailangan yung magsulat at makinig. And then demonstrate competencies, okay? In assessing nutritional status and feeding practices. So, meron tayong mga competencies dyan. If you think there is lacking, pag after ng workshop na ito and you think there is lacking, then that's the PPA that you will enroll for budgeting next year. And then administering standards and appropriate nutrition interventions for emergencies and disasters. Okay, these are more of the standards, ano ba yung standards na tinitingnan natin, which I think will be shared to you later pag nasa cluster approach na kayo. So there are basic standards na sinusunod natin. Like if we are below the standard, then we need to exert more effort. Okay? And then develop nutrition in emergencies plan. So you have this nutrition in emergencies plan. For the information of everybody, nutrition is a cluster also under the DRRM for health. Okay? Kasi apat po ng cluster yon, and quite cluster for health, and nutrition is one. So, develop nutrition in emergencies plan. You may also refer to the DRRMH so that hindi siya hiwalay. They should be connected with each other. And number 4 is need to ensure integration of NIE plan in the contingency plan or development plans of the respective local government units. So there are plans that we have to prepare for during the workshop. And training agenda for module 1 that will be mine. Okay? So overview of the DRRM, mukhang nagsawa na natin pa ating mga barangay officials, but allow me to repeat again and make it more exciting and interesting. Okay, Module 2, Introduction to Nutrition in Emergencies. We have to look into the basic concept of nutrition and malnutrition, and then the importance of nutrition in emergencies, nutritional assessment, and nutrition in emergencies interventions. These are the strategies. Ano ba yung mga interventions natin? These are the effective and efficient strategies that will address malnutrition in the city. Module 3 is the disaster DRRM. We have the nutrition in emergencies. As they should be related with each other. Hindi siya dapat independent because DRRMH is the other plan. It's bigger than the cluster plan. And documentation, capturing and sharing lessons learned. So we have a lot of lessons encountered during the previous disasters and especially during the COVID pandemic. As they say nga, is experience is the best teacher because we draw lessons. And then module 4 circulation exercise and
Hello, ate.
So house rules, attendance. Of course, attendance is a must. You have to complete your attendance necessary to duty. You have another guidance next year. And then the 3 golden rules, always wear, pero hindi kasi maintindihan pag with your permission. And then, of course, we have to maintain public health standard, wash hands frequently and thoroughly, and then maintain distancing from others. Distancing po. Physical distancing, ha? Okay. Then, please put mobile, silent phone, learn and calm. So, yun po natin. Okay.
Ada ibaga nila niti cucu ada mati sarili nga sarili no pastinya manang usually no ka-staff at no karon ay kami secretary schedule din sa mga ang takdo ng training takta
citation I used from the Department of Health, but I modified it kasi may mga updates pa tayo na kailangan gagawin. So, based on Module 1, the RRM, okay, Disaster Risk Reduction and Management.
Tanong ko na ahad kertigayap ang niya parehas din yung banang malit kalang internal yung salita tayo na compound
May quiz din ako sa inyo. Kala nyo ba nakaligtas na kayo? Pati ko po to. Okay. So our learning mode objectives is at the end of this module, the participant should be able to first explain the common terms used in the RRM. Second is illustrate the RRM framework in the Philippines. And third, identify legal mandates relevant to the RRM. Okay. So common terminologies, activity 1.1, alam mo ba? Ano ba yung alam mo? Okay? So, I will read aloud the questions and kayo po yung sasagot. Okay? So, first is high prevalence of washing is an example of capacity, true or false?
False.
High prevalence of wasting is example of capacity, true or false?
False.
False, okay? Ano ba yung high prevalence? That is vulnerability. Okay, we will go back to that later. Pero assessment lang, pre-assessment lang ito. So vulnerability is the characteristics and circumstances of a community, system, or asset that will make it susceptible to the damaging effect of a hazard. True or false? Who says true? Raise your hands. Oh, hindi ko kayo i-record. Who says true? Okay, who says false? It's true. Okay. Young children belong to the most vulnerable group, true or false?
Yes.
Malakas na true. Capacity refers to the combination of all the strengths, attributes, and resources available within an organization, community, or society to manage and reduce disaster risk and strengthen resilience.
True.
True. Yan, medyo may confidence na. Yun ang gusto ko. Okay. So, number 5 is
False.
local knowledge is an example of capacity.
False.
Local knowledge is an example of capacity.
False. False.
Knowledge,
Is capacity is
ligtas
power.
na may alam. That's true. Okay, number 6.
True pa doon, local knowledge is that.
O kung may alam tayo, may capacity, we know how to cope with it. Diba? Adaptive capacity. Number 6, number of trained personnel in nutrition and emergencies. Gaya ninyo is an example of vulnerability. True. Who says true? Who says false?
False.
Matulog na false. Okay. SARS-CoV is an example of a biological hazard.
True.
Biological hazard.
True.
True. Okay. Hazards are events that could occur.
True.
True. Vulnerability is the susceptibility of communities to hazards.
True.
Matunog na?
True.
True. And then lack of capacity is lack of resources that can alleviate the negative impact of hazards. True. Lack of resource. Kung kulang ka ng resource, yung lack capacity pa rin.
Resources that
Okay.
can alleviate the negative impact of
Okay. Number 11, an average of 15 typhoons make landfall in the Philippines, true or false?
False. Mas marami.
Okay, officials natin.
Mas marami.
True or
False.
false?
False. Mas
Who
marami.
says false?
Mas
Who
marami.
says false?
Mas marami.
Ilan dapat?
20. 20. Oh.
On the average.
20.
Okay, the Philippines is located in the Pacific Ring of Fire.
True.
Climate change is exacerbating the impact of weather-related events in the Philippines.
True.
Tropical storms, cyclones, hurricanes, and typhoons, although named differently, describe the same type of vulnerability.
True.
Ulit?
True.
Ulit?
True.
False na lang. There are type of hazards.
Ay,
Di ba
vulnerable hazards.
ang mga yan?
Oh.
Hindi siya
Hazards.
vulnerability.
Oh,
Okay,
hazards.
ibig sabihin,
Sorry.
medyo nagkakalituhan pa tayo sa mga basic terminologies na
Hazards.
gagamitin
Ano pa ba?
natin later. Okay, and then the community is a group of people, property, services, livelihood, and environment.
True. Community. It's a group of people. Proper.
True or false?
True.
True or false?
True.
Ano yung community?
Group of people.
People and
Environment.
that's true. Okay, pag sasabihin natin community, hindi naman pwedeng people lang. Ayun talaga.
People. Environment.
Okay.
Lahat.
So, ano ibig sabihin ng hazard? Okay, we go there na sa basic concept. Hazard is a dangerous phenomenon, substance, human activity, or condition that may cause, first, loss of life or injury. Yan, casualties yan. Property damage, social and economic disruption, environmental damage. Klaro? Klaro? Okay. Types of hazard, meron tayong natural. Hindi naman, natural disaster naman yan. Sino na magsasabi na natural disaster dapat meron? Wala. So hazard muna tayo ha. Okay, so natural hazard, earthquakes, storm, typhoon, yan, volcanic eruption, flooding. Pag technological, kasi pag hazard ang pinag-uusapan, this can be hazard or human-induced hazards, okay? They can be technological, industrial pollution. It's good wala tayong malalaking industry like the cement, halimbawa. And then nuclear radiation, wala tayo yan. Toxic waste, or transport accidents. So they can be technological hazards. Biological hazards, kaya nakasama po ang ating SARS-CoV or yung COVID-19 is pathogenic microorganisms, blood, and bodily fluids. And pag societal naman, ito yung mga terrorism, mga civil unrest, sporting events, mga ganyan. So there are 4 types of hazards. Okay, but in the DRRM, we only use yung basic natin sa DRRM is we only use either man-made or human-induced or natural hazards. Okay? But then we also look into the term emergency. Okay? Emergency kasi nutrition in emergencies. So ano bang emergency? Emergency is any actual threat to public health and safety. It is a situation where there is imminent or actual disruption or damage to communities. Okay? Kaya, and there's a period characterized by, there is chaos, there is death, there is injuries, there is damage to properties, displacement of families, and inadequate or lack of basic supplies. Kung wala lahat ito, hindi natin masasabi na may emergency. Okay? Okay pa? Okay. Good. Pag disaster naman, it is a serious disruption of the functioning of a community or a society involving, disruption ito ha, human, material, economic, or environmental losses and impacts, which exceeds, ito ang term nito, which exceeds the ability of the affected communities or society to cope using its own resources. Okay? Kung halimbawa meron tayong flooding at wala namang casualty, wala namang damage to properties, Is there a disaster there? Wala. Only when this disaster or this event exceeds yung coping capacity ng community. Okay? Kaya magkakaroon ng disaster. Halimbawa, Bohol earthquake, Typhoon Yolanda, nag-exceed na kasi ang dami nating mga record of casualties and damage to properties. Ganyan. Landslide in Benguet, Marawi Siege, yan ang disaster. And disaster impacts may also include loss of life, injury, disease, and other negative effects on human. So human, yung effect niya to human, physical, mental, and social well-being. Together with damage to property, destruction of assets, loss of service, socio-economic disruption, and environmental degradation. So yun yung impact ng disaster. Diba? Yun yung effect, ibig sabihin. Pag vulnerability naman ang pinag-uusapan, this refers to the characteristics and circumstances of a community, system, or asset that make it susceptible to the damaging effect of a hazard. Yung susceptibility ng isang community. Ano ba yung categories? They can be intrinsic, specific to individuals such as age. Di ba? Yung age, yung senior citizen, and the young ones, the children. They are vulnerable. So that is intrinsic kasi hindi nila pwedeng, that is intrinsic of the person, di ba? Yung sex between male and female, alin doon ang more vulnerable?
Female.
Tahimik yung mga men, no? Oo na, women daw. Okay? And then they have status, di ba? Nung nagkaroon ng COVID, sino ang vulnerable? Yung mga may health
Problems.
conditions. Okay, mobility. Okay, isa din yan, yung mobility. Halimbawa, yung persons with disabilities. Halimbawa, yung pilay, hindi naman siya kasing tumakbo na kasing bilis ng isang normal. Di ba? O yung mobility is wala silang capacity to move. Mobility kasi is movement. Okay? And then, literacy, yan. Low knowledge, kaya i-confirm natin yung kanina, yung lack of knowledge. Okay? And then, habits, ayan. Sino ang vulnerable? Yung mga sa lifestyle natin. Okay? Huwag naman po yung tamad. Pwede pang ayusin yun. Pero yung habits kasi, mga naninigarilyo, ayan. Yung mga may habits talaga na hindi maganda sa health. Okay? And then, yung mga habits ng pagtatapon ng basura, ganyan, sa waterways. And also behavior. Now, we also have extrinsic, which is shared by groups within the community such as location, environment, poverty, availability of service, or culture. So, lahat naman ng mga barangays are reached by, they are being reached with basic services ng LGU, di ba? Pero if there is, halimbawa, isang barangay na hindi siya na-reach ng basic service natin, that can be an extrinsic vulnerability. Okay? So, vulnerability for typhoon located along ito yung example, located along the North Pacific Basin where 75% typhoons originate. Okay? So, we are vulnerable to typhoons. Philippines, vulnerable to typhoon. We are also vulnerable to landslides, di ba? Kasi rain-induced landslides can be secondary to flooding. And also for earthquake, the same with typhoons, 20 earthquakes per day or 1,000 quakes per year. And 90 destructive quakes in the past 400 years. So hindi pa nakasama ito yung July 27. Okay? So another vulnerability, or concept of vulnerability, factors that determine people's level of vulnerability and extent of their capacity. So yung capacity is either individual or community level na capacity yan, ha? To resist, cope with, and recover from hazard. Okay? Yung iba, meron silang capacity but they have difficulty recovering from the hazard. Diba? So, ang sinasabi niya, extent of their capacity. Ano ba yung extent ng capacity on individual level or in community level to resist, or to cope and recover from hazards? So, itong mga factors can be yung physical, economic, social, and political. This can be the factors, ano? And then poverty, of course, is a major contributor to vulnerability. Another is people with high levels of deprivations, yung mga deprived people. Halimbawa, more likely to live and work in areas exposed to potential hazards. Okay? Levels of deprivation, halimbawa dito sa Baguio, wala naman kasi mga socialized housing. So, madami namang mga areas na no-build zones or mga risky areas. You know, it's because of poverty they can be exposed, to potential hazards. And then less likely to have resources to cope with when a disaster strikes. Kaya yung very important talaga yung ating resources at the local level. Even down to the barangays kasi kayo po yung first responders on the ground. Okay, vulnerable groups, populations who because of constraints of an economic, social, ethnic, biological, physical, or geographical nature are less able to cope with the impact of hazards. So what are we coping up with? It's really the impact of hazards. We cannot totally prevent hazards, di ba? But then, yung vulnerability ng community to the hazards can be addressed proactively. So that when there is disaster, medyo mababawasan yung kanilang vulnerability and increase pa yung kanilang capacity to cope with the disaster and to recover from the disaster. Okay? So those can be the constraints, mga economic constraints, social, ethnic, biological, physical, or geographical nature. So for the city of Baguio, generally geographical, yung ating vulnerability. That's why we are vulnerable to landslides. Okay. And, nasa capacity. So, capacity means the combination of all the strengths, attributes, and resources available within an organization. Okay? At the barangay level, do you have this capacity? So, in order for you to determine whether you are capable or not, then you have to look at the capacity first. Do you have the people on the ground to respond? Do you have the necessary equipment? Do you have the supplies? Yung mga yon, okay? So, even before a disaster, there should be, di ba, meron tayong mga contingency plan, kaya later on, magkakaroon ka ng contingency plan. That is part of the contingency plan, na i-prepare ninyo. So, yung mga kailangan din to address yung nutrition in emergencies. And then, capacity may also be described as the capability. And then, capacity may include first, infrastructure and physical means. Can be the institutions. Do you have institutions at the barangay level who could help? Or who has capability? Halimbawa sa schools din, di ba? Pag in the absence of an evacuation center, alin po yung ginagamit natin? It's basically the schools. Di ba? Do we have those? Yan. Societal coping abilities. And then human knowledge, skills, and collective attributes such as social relationships, leadership, and management. Okay? So yan po yung ating capacity. And of course, we also have risk. Ano bang pinag-uusapan about sa risk? Tingnan ninyo, pinag-uusapan pa lang natin yung risk. Sa taas, nag-iingay na sila about resilience. Okay? Kasi hindi pa natin na-address tuloy yung risk. But if we are able to address yung risk, we are now building the resilience of our community. Di ba? So ano bang ibig sabihin ng risk? The combination of the probability of an event and its negative consequences, and the combination or association among hazard, vulnerability, and capacity. Sino ang magaling sa algebra? Okay, so risk is equal to hazard. Merong existing hazard. Merong vulnerability, yung community, and pero sa baba, that can be lowered. Yung risk natin can be minimized if we increase our capacity. And increasing our capacity is actually addressing the need of the vulnerable and mitigating the impact of the hazard. Okay? Okay pa? O, ito na nga. Sige, yan na nga. O, simple illustration of disaster risk. So, anong nakikita natin dito? Okay, pag-imagine O, ano yan? Hazard. May hazard, no? Yung bundok, may bato na malaki. So, by looking at that, there is already hazard. Okay? Ngayon, may sa baba kasi ng ito, bundok with the boulder, meron siyang exposed. May exposure yung nasa baba. So ano doon yung exposed is the family, the property. Di ba? Meron bang vulnerable dyan? May bata, may babae. Okay na din na natin. And then, kung ganyan so ganyan, may exposed and vulnerability, that is disaster risk. There is disaster risk. Kasi, nabagsakan, di ba? May risk siya. Pero, kung gagawin natin ng paraan, like put mitigation measure, para hindi aabot yung bato at tatama doon sa family and the property, that is resilience. Ngayon, ito pa yung ina-address natin kasi pag na-address na natin ito, we can achieve resilience. From risk to resilience na tayo. Okay? Okay tayo? Okay. So there is no such thing as natural disaster. Only natural hazards. Okay? Only natural hazards. And we make choices as to where we inhabit. Tayo yung nag-decide kung saan tayo magpapatay ng bahay, kung saan tayo titirahin. So it's really very important that we have to increase the awareness and understanding of our community, of our constituents on the risk that is at hand, that is at stake. Kung halimbawa doon sila sa waterways, magpapatay ng bahay, doon sila sa no-build zone, magpapatay ng bahay. Diba? Because we make the choices. It's our choices. And for us, as officials, no, we have to increase the understanding of our constituents kung ano po yung risk. Okay? How we build our houses. Bakit every after a disaster, pare-parehong bahay yung nasisira? Maybe it's because ayaw nilang i-improve. Diba? If we rebuild our house, it should be built back better. Diba? It should be built back better. Magbaband-aid solution lang ba tayo? No. Diba? And what research we do. Dito naman sa atin yun. And then risk is the combination of hazard, exposure, and vulnerability. And then death, loss, and damage. Ayan, yan po yung pinaka-main factor para ma-determine natin kung may disaster. In the absence of all of this, walang disaster po. Okay? Okay pa? Yes. For another exam? Joke lang. Ayan. So yan, dinagdagan natin from previous na hazard times vulnerability. May exposure din naman tayo. Okay? So we have to include exposure in the numerator. And then, yan po, we need to address yung denominator kasi kung mas mataas po yung value ng capacity natin, that will decrease yung risk. Okay? Yun. And then community. Ayan. A community consists of 5 elements. So meron pong tao, may property, may services, may livelihood, at environment. Yan yung community. That's the ecosystem. Kasi baka ang iniisip niyo, community is just the people, hindi po. Meron property, meron dapat service, meron livelihood, and environment. Okay. So, the logical framework of terminology, number 1 is the hazard. Diba? And then, merong risk, emergency, vulnerabilities, disaster, and capacities. And below, the main is the basic one is the community kasi sila po yung affected. Sila yung most affected, kaya nasa baba po sila. Sila yung nasa foundation, no? Is the people, property. At yun yung ina-address natin ng mga sa barangay level at saka sa city level. Okay? It's the community. That's why we have to build resilience, community resilience. Diba? Naano natin doon. So, maaalala mo pa ba? Parang may nakaraan ito. Ano? Okay. Okay. Tingnan ko yung activity natin dito. Parang may nakaraan ito. Parang naalala mo pa ba? Ano pa? Okay. So, ito. Naalala niyo ba? Disaster? Ano yung hazard? Ano yung vulnerability? At ano yung capacity? Okay. Pag typhoon, halimbawa yung typhoon Yolanda, saan natin siya i-fall under?
Disaster talaga nangyari.
Disaster. Yung July 27 earthquake,
Disaster din. Sa lalo sa
pag lang yung
Abra.
bagyo ha,
Sa Abra, disaster
yung
sa
buo
Abra.
naman ang tingnan natin.
Disaster. Disaster nangyari na.
Yung COVID-19,
Disaster. Pandemic.
yung armed conflict,
Hazard.
hazard, yung climatological, climate-related,
Hazard.
climate change,
Hazard.
hazard. Okay? Location of the typhoon belt. Location on the typhoon belt.
Hazard. Vulnerability.
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 Location on the Pacific Ring of Fire.
Vulnerability.
Human knowledge.
Capacity.
Infrastructure. Preposition logistics.
Capacity.
Availability of trained personnel like you.
Capacity.
Okay, very good. So yan po. O tingnan din yung hindi na kayo nag-exam. Mas maganda palang plenary exam, no? Congratulations. Okay, so Philippine Disaster Risk Reduction and Management. So, meron tayong legal framework for the Philippine Disaster Risk Reduction and Management. Pag DRR ang pinag-uusapan, this refers to the policy objective of disaster risk management. And we have to define ano ba yung goal ng DRR, ano yung objectives, ano yung objectives and different scales with concrete targets and indicators. So DRR. So very important po yung data natin. Saan makikita yung mga goals and objectives? It's in the plan. Diba? It's in the plan. And then, DRR also aim at preventing new, mapiprevent ba natin yung new disaster risk? As much as possible, we want to prevent, diba? Pero, di ba, yung dun sa picture kanina, as much as possible, they want to prevent. Pero, paano kung natumba niya yung fence? Meron pa rin residual risk na ina-address naman. Okay? So we cannot fully prevent a disaster risk, but we can minimize the effect or the impact, no? And managing residual risk. So yun po yung residual risk. Hindi natin fully na ma-prevent yung hazard, kaya yung natitira, yun yung ina-address natin kaya meron tayong disaster preparedness. Okay? And then, yun, contribute to strengthening resilience. So from risk, as we address yung risk, as we build the capacities of the community, we are already improving or building their resilience. Okay? And achievement of sustainable development. Alam niyo ba yung SDG? Sustainable Development Goals? Ilan ang goals doon?
16.
17 po.
16.
That is the global commitment of the global commitment po yun ng UN. Okay? And we are signatory to that. Kaya nga, pag yung mga data hinihingi nila sa atin, kasi there are indicators doon na nagsasabi na ano yung accomplishment ng bawat LGU towards this indicator of attaining yung number 1 is zero hunger. Zero poverty, di ba? So tayo, meron tayong mga indicators, may mga data tayo na pinuprovide to say na, oh, Baguio City is indicating, is contributing, or is addressing poverty. That's why we have decreased our poverty incidence from 1.5 to 1%. Alam niyo na ba yan? At na-address yun because of interventions that we do. Di ba? At yung sinasabi dito, yung disaster risk kasi, 70% of 60 to 70% of the causes of poverty around the world is caused by climate change and disaster. Diba? Climate change and disaster. Ayan, application of DRR policies and strategies. Ano ba yung mga DRR? Meron ba tayong DRR policies? Yung halimbawa, yung zoning ordinance is actually a DRR policy kasi it indicates na ina-identify niya doon yung mga no-build zones. Bawal magpatayo ng bahay doon, bawal i-develop yun. And then we also have strategies. We have strategies. So take note that ilan yung thematic areas ng DRR?
4.
DRRM?
4.
4. Okay, so 4 po yung ina-address natin doon. Ano yung priority na dalawa?
Preparedness and mitigation. Preparedness and mitigation.
Okay, so we have prevention and mitigation. Okay,
Preparedness
doon natin
and
ginagawa yung ating mga plans, contingency plan and all. At budgeting doon din. We also have the preparedness. Kasi we cannot totally eliminate or prevent yung risk.
Preparedness and
That's why we have
mitigation,
this
also the
risk awareness.
prevention.
And then, response. Ayan. Huwag tayo mag-focus sa
Response and
response.
recovery.
I-focus muna natin sa dalawa kasi kung ano yung gagawin mo, yung efforts and initiatives mo dun sa first 2 thematic areas, magre-reflect yan sa cost of response. The more vulnerable and the lower capacity yung community, the higher the cost of response. Di ba? Agree ba? Hindi. Parang ayaw yung mag-agree. Okay. So, sabi ko, yung SDG, Sustainable Development Goals, has 17 goals yon. And Philippines is a party to go to achieving the Sustainable Development Goals. Ngayon, yung sa DRRM naman, we are following the Sendai Framework. Okay, so ito naman is global framework for DRRM. Okay. Ang pagkakaiba nun, hindi natin maa-attain kasi yung Sustainable Development Goal without attaining itong 7 na targets ng DRRM, ng Sendai Framework. Okay, bakit? Nauna itong Sendai Framework na lumabas bago yung SDG. And yung SDG, na-make up sila ng indicator from the Sendai Framework. Dahil nga, as I mentioned earlier, 60 to 70% na cause of poverty globally or around the world is caused by disaster. Kaya, yung mga indicators nito nasa SDG. Okay? So, we can never attain SDG without attaining the targets for the Sendai Framework. Okay? And ano yung number 1 na may 4 na priorities Ang Sendai Framework, number 1 is understanding disaster risk. Okay? If you have built the understanding and awareness of your community on disaster risk, hindi na kayo mahihirapan na magpalikas sa kanila. Diba? Yung mga preemptive evacuation, huwag na nilang antayin because they already know that there is a risk that's waiting for them. Anong nangyari doon sa Bulacan? Bakit namatay yung 5 volunteers? Dahil sa katigasan ng ulo ng community. They were warned of preemptive evacuation. Pero hindi sila umalis. Kaya yung volunteers, sila yung pumunta for forced evacuation. Kung mataas yung understanding nila on disaster risk, hindi sana nangyari yun. Diba? Kaya nga whole of society approach, it's everybody's business. Kasi even a family can assess, can have the risk assessment kahit sa household level pa lang. Diba? Yun. And then another one is strengthening disaster risk governance to manage disaster risk. Kaya that's the main reason why I really push for the strengthening of the CDRRMO. Because we cannot increase our manpower without upgrading it into a department, which seldom understands. Ano? And then we have also, based on the RA 10121, 20 plus po yung ating mandates doon, yung ating functions. How can 11 people or 17 people accomplish yung mandates doon with just 17 people? So yun naman. So very important that we have to strengthen disaster risk governance. At the City Council, wala po tayong committee sa Council on Disaster and Climate Change. They always put it under peace and order. Peace and order ba yung disaster? It's different. Diba? Yung health, yung isang committee is health, sanitation, and environmental protection. Protection lang ba? O bakit, kung gusto natin isama doon yung climate change, then hindi na lang protection. Tanggalin na yung protection. Okay? And then investing in disaster risk reduction for resilience. Kaya nagkaroon tayo ng DRRM fund. Okay? And then, kasi sabi nga ng Assistant Deputy Secretary General ng United Nations for DRR, sabi niya ganun, you may invest trillions of infrastructure, of development infrastructure, but one unmitigated disaster may wipe them all. Diba? Kung hindi natin ina-address, that's how important DRRM is. And then, enhancing disaster preparedness. So ito na, enhancing disaster preparedness for effective response and build back better. Okay? And build back better. Ito kasi, pag build back better, yung sinasabi dyan, may nasira na eh. Mag-build back better ka lang. Ngayon, ang advocacy ng Climate Change Commission is build right at first sight. Tama. Di ba? Build right. Mag-build ka pa lang, dapat you build it right at first sight. Okay? Kaya yun yung advocacy ng Climate Change Commission. We can have this build back better, pero ang implication niya may nasisira kasi eh, by the disaster. And then you build back better. Okay? Pero yun, yung build right at first sight, magpapatayo ka pa lang, dapat resilient na siya. Yun yung ibig nang sabihin. And then the 7 targets, ito yung disaster, decrease disaster mortality. Yan yung deaths. Diba? Yung deaths. Kaya nga, we feel very sad kung may, and very alarming kung may namamatay during disaster. Diba? Hindi tayo tinitigilan ng media. And then, number of affected people. Ayan, aside from death, also casualty pa rin, injured, missing people, diba, affected, economically, socially affected. Ayan, dyan siya. And then, decrease economic loss. Diba? Sino ang nag-loss sa atin? It's our economy. That's why we are only working with the revenue that we had in the past. Previous 2020 and 2021. So bumaba kasi affected yung ating hotel and restaurants, affected yung ating tourism. So maybe it's now that we understand na kahit ano pang sabihin ka, Mayor, we have to reopen gradually our economy. Last year, di ba? And then ito naman, infrastructure damage. O yan, may infrastructure damage. Dapat substantially reduce yan. But we have to increase DRR national local strategies. And this is one strategy, di ba? And then international cooperation, that's again national, but we also have international cooperation because yung ADB, the World Bank is already assisting the LGU to improve its resilience. And then early warning and disaster risk information, di ba? Meron tayo, alam natin about yung disaster risk, about information about disaster. Alam na natin yan, but is this accessible to the community? Naiintindihan ba ng common tao natin? That's the challenge. How do you cascade yung climate change na concept to the community na maiintindihan nila? So, nung last week, I went to I was invited to a DSWD forum on stock taking, shock and responsive and adaptive shock social protection. Shock responsive social protection. And yun yung sinabi ko sa kanila, you don't have to reinvent the wheel. Kasi you have already a very comprehensive program. Hindi nyo na kailangan baguhin eh. All you have to do is to put climate lens. I-mainstream lang yung climate change and disaster risk reduction doon sa programs nila. Di ba? Yun na yun. And then they were shocked. Oo nga ano. O lucky na tayo matibay sana na-invite niya. And then, oo nga ano, sabi nilang ganun. Eh sabi ko, you already have comprehensive program. You don't have to reinvent, andun na yun. All you have to do is to put a climate and disaster risk lens doon. Okay? So yan yung sinasabi ko na SDG, 17 goals. Take note, number 1 is no poverty. Tayo 1% pa. Meron pa tayong 1%. Zero hunger. This is what we are addressing also, zero hunger. Because this makes the people or community vulnerable. Ayan. Good health and well-being. Yeah. So every goal, meron tayong specific na targets. 169 targets sa lahat. And we also have specific indicators. So, doon natin makikita kung saan tayo nagko-contribute. So, hindi lang yung LGU, hindi lang yung HSO ang tumitingin ng contribution natin. It's basically at the national and even to the global. Okay? So, the vertical linkage of DRRM plan. So, meron tayong DRRM plan from the national, di ba? Meron tayo yung NDRRMC kasi, kaya meron tayong NDRRM plans. Meron din tayo yung regional. Meron tayo yung city. And meron din tayo yung VDRRM plan. So dapat yung mga plans, when you do another planning, okay, when you do another planning, DRRM planning, you have to make sure that your strategies, your priorities are aligned to the national. Kasi yung national, naka-anchor na siya sa Sendai framework, which is the global. Okay? Yun. Hindi pwede, ito ang gusto ko, ito hindi. We need to be one. We need to be one. We need to unify all our efforts. Diba? Small efforts from the barangay, pag i-combine mo yan, that's already big. So we have to align, that's what we call the vertical alignment of the RRM plans, okay? And that will lead to the national DRRM goal of, kindly read?
Safer and adaptive.
Ayan, towards sustainable development. At yung measure ng sustainable development, yun yung SDGs. Yun na yung SDGs, okay? So yun, towards safer, adaptive, disaster-resilient Filipino communities. Okay, towards sustainable development. And ito, yun nga yung first DRRM framework natin. Yung first kasi this is yung risk. Di ba ito yung pinaka-first priority ng Sendai framework. So we know already our risk, we know the hazards ng LGU, we know the vulnerables, we know kung ano yung hazards. We know where our exposure, di ba? Alam na natin kung saan tayo exposed. And we have this understanding of the risk. So there is risk at hand. Alam din natin kung ano yung mga capacities ng ating community. And this has to be integrated in the 4 thematic areas. So yung 4 thematic areas, alam niyo ba na before yan, yung linya na ito, hindi, di ba may overlaps itong 4. Before, hindi yan nag-overlap. Pag disaster prevention and mitigation, yun lang ang ina-address mo. Pag disaster preparedness, yun lang. But it has evolved Nag-evolve yung framework natin in such a way that they overlap. Ibig sabihin, may effect ang ginagawa natin per thematic area to the rest of the thematic areas. Diba? So, yung disaster prevention and mitigation, may overlap yung disaster preparedness natin.
And disaster preparedness natin may overlap yung disaster response and early recovery, di ba? Nakikita natin yung effect niya eh. And yung disaster response and early recovery, if we are very much prepared, and we have these existing plans, we can mitigate the cost or the impact of disaster. So, yeah, the cost of response will become low. And bababa din yung cost of recovery and rehabilitation natin. And as we do, din, kung halimbawa yung mga nasisira na mga infrastructure, we have to anchor it to the principle of build back better. That is already prevention, di ba? So it's really a cycle. It's really a cycle, no? So, ayan. So, sa atin naman, nilocalize na natin yung vision, resilience vision natin. So, yung safer, adaptive, and disaster resilient Baguio City towards sustainable development. So, there are 3 key result areas. So, 4 na thematic areas. Pero meron tayong 3 na key result area. That one is disaster risk reduction. And then disaster preparedness and response. And build back better. Okay? And build back better. And doon po sa kabila, that is the 7 targets and the 4 policy areas ng Sendai framework. Okay? So yan. First thematic area, pakibanggit. All of you please.
Prevention and mitigation.
Next.
Preparedness.
Next.
Response.
Next.
Rehabilitation and recovery.
Okay. For under prevention and mitigation, ano bang piniprevent natin dito? Prevent the occurrence of hazards and or mitigate its potential impacts on life, property, and the environment. For preparedness, we have to reinforce, meron na tayong capacity, but we have to reinforce and strengthen the capacities of the city and communities on their readiness to manage emergencies and the impact of disaster. And then next is response. Okay, so provide immediate, effective, and coordinated gender responsive. Gender responsive. Kunayo man. O wag po unahin yung mga kalalakihan. Okay. And culture sensitive. Kunayo man, culture sensitive.
Culture sensitive.
At may mga Muslim brothers pa tayo dito or sisters?
Meron.
Wala?
Meron.
Meron yan. I appreciate yung initiative ng ating Muslim organization dito sa Baguio. Kasi they want us to provide them training on disaster preparedness. Tapos, may sensitivities sila eh. Pag magre-respond ka ng babae, dapat babae magre-respond at hindi mo sila basta-basta hinahawakan. And we learn na yung ating Muslim community has their own emergency operation center. Tama po ba?
Okay.
That's operating 24/7. And they have their own ambulance. O, diba? Yun. So, maganda yung ginawa nila because we are culture sensitive. Eh tayo naman, we have, during disaster and during emergencies, we have this low awareness on culture eh. Eh, multicultural yung Baguio. O, diba? And to address the culture sensitivity, ayun po, meron po silang sariling emergency operation center. So, palakpakan natin sila. That's their initiative, and I appreciate that. In the talks that I do, even at the national, mini-mention ko po yan. Okay. Also, dito naman, yung dito sa COVID-19, diba? Cremation. Anti-culture sa iba. Diba? Anti-culture. How can we be culture sensitive? Bakit how can we be culture sensitive? Diba? Kaya niya pinapakrimate kasi ayaw nilang malamayan, prevent the spread, diba? Mga ganon. What if we ask our health services office. Sabihin natin, sir, or sa DOH. Kasi yung hiling, yung auntie ko kasi ang hiling niya bago siya namatay kasi na-COVID siya, ang hiling niya is ayaw niya magpa-cremate. Naku, muling hiling niya, paano kung din ako? So what I did is ask naman the HSO's permission. Sabi nila, oo nga, mahirap din yan. Sabi nila gano'n. Siguro ganito na lang. So they can provide other options like from the morgue, so dun sa BGH morgue, they cannot release that without a coffin, di ba? So, magdadala kami ng coffin. Yung cadaver is sealed. Sealed muna with a bag, sealable bag, and then lalagay doon sa coffin na sealed pa rin. And then, nakaprepare na yung burial site, all they have to do is to bring directly to the burial site. That is culture sensitive. Okay? Walang service. And then yung mga magdadala doon, they have to quarantine themselves. O diba, may violation ba tayo doon sa intention or objective ng cremation? Wala po. Okay? Diretso yun. And then after a year, hinukay na nila, and then they have to bring it to kung saan talaga dapat siya nailibing. Okay? So yun yung response. Take note, immediate, effective, and coordinated, gender-inclusive, and culture-sensitive response mechanism. Okay? And then, for rehabilitation and recovery, restore and improve facilities, livelihood, and living conditions of affected communities, and communities, including efforts to reduce disaster risk factors. Okay, so very important po yung ating livelihood, yung ating facilities. Kaya nga, doon sa rehabilitation plan for the COVID-19, ang isang pinupose ko that time is the strengthening of the local health system. Strengthening of the local health system, ibig sabihin down to the barangay. And we are lucky naman that we are the pilot for the universal healthcare, and that's why we also have the DRRM for health. Okay? Na institutionalization. And then that leads to the overall goal of yung safer, disaster resilient, value city. Next is ito yung nasa DRRM plan natin na hindi pa natin naisulat. Hindi pa natin naisulat. Pero I just give you the highlight. Ito, sa prevention and mitigation, so aside from yung binanggit natin kanina, these are specific objectives natin. Because of our goal of prevent the occurrence of hazards, no? We have these specific objectives. Mainstream DRRCCA in local policies. Dapat meron din tayong support policies for that. We have the plans. As hindi lang po yan yung BDRRM plan or DRRM plan, but also sa comprehensive development plan at the barangay sa BDP ninyo, barangay development plan, and also of the comprehensive land use plan, and also of course sa budget, which is not an issue naman sa atin. And then improve access, understanding, and use of updated risk information, DRR-related statistics and research. That's why it's really very important na kung meron kayong data, you have to keep it. You make a record of your data. Kasi very important talaga yung data. It will tell story. It will tell story. Halimbawa, sabi ni Mayor, you have to prepare for October, sabi. Kasi napansin ko, based on historical data, every 3 years may malakas na bagyo. Hindi po kayo tinatakot sabi niya gano'n. Pero mas maganda na more over-prepared pa rin tayo. And this year is the 3rd year from the last, sabi niya gano'n. So, wala namang masama na because he based it on data. So, data can tell stories. No? Data can tell stories. And ang ginagawa kasi natin is evidence. The data are evidences. So in doing our plans, it should be evidence-based. In crafting a policy, it should be evidence-based. Meron tayong pinagbabasehan. Because no matter how many times na mag-chu ka, explaining yourself without giving any data or facts, hindi yan pakikinggan. Okay? And then, develop community-based hazard and risk-based assessment. Meron po tayong maps. Next year, magkakaroon tayo ng community-based na 3D mapping. Because not everybody at the barangay can read yung GNS map. Diba? So, we will pilot muna yung mga barangays, but it will start next year. So, ang gagawin natin, 3D na scale model of the barangay. Alam niyo po yung pin map. So that yung barangay, dapat aware sila na, oh, ito yung buntis, ito yung may sakit, ito yung sa senior citizen, ganyan. Pag habang nag-graduate sila, tinatanggalan na nila ng pins. Ibig sabihin, kung ano yung existing na nasa pin, na nakapin doon sa map nila, yun yung priority nilang is-save during disaster. Okay? O yung kung nanganak na si buntis, tanggalin na. Okay, pero may vulnerability pa rin doon kasi yung bata. Okay, next, create a healthy and equitable environment. Okay, healthy and equitable environment. And then improve structural integrity of horizontal and vertical infrastructure. Ano yung horizontal? Roads and bridges. Okay? Vertical are buildings. Okay. So this, so yun, and protect public health and safety. So very important yan. So under disaster and prevention, disaster prevention and mitigation yan. We also have this disaster preparedness. Ano ba yung disaster preparedness natin? Increased level of awareness, communities of hazards, exposure, and vulnerabilities because we are dealing with the risk. We have to increase the adaptive capacity and coping mechanism of the communities on the adverse impacts of hazards. We cannot underestimate what an individual person can do, regardless of age and regardless of sex. Okay? Yung bata pwede siyang mag-save. Yung matanda pwede siyang mag-save. Okay? All we have to do is to give them the right information, we capacitate them. Okay? So kung yung gusto ng barangay sila lang nagre-respond, di ba nyo na i-capacitate yung mga vulnerable sector at kayo na ang na-exhaust during this disaster. Mga ganon. But because you don't want to be exhausted during disaster kasi kulang din naman kayo ng tao, then why not focus on the disaster preparedness and then the prevention and mitigation. Okay? Increase the capacity of institutions for risk governance to avert loss of lives and assets. Develop and strengthen capacities of the LGU and partner stakeholders on disaster management. That's why we are in partners also with the non-governmental organizations. Strengthen partnership among the key actors and stakeholders. And then develop and implement a comprehensive and mutually reinforcing disaster preparedness and response plans and systems. So, dyan natin gagawin yung ating mga response plans, yung ating mga disaster response plans, dyan natin gagamitin.